Hello, fellow classmates. My name is Ashton Primero-Priest, MSN, RN, NEABC, and today I'm presenting to you my project on mindfulness-based interventions and resilience in critical care nurses. Resilience is known as the ability to adapt to stress. And this has been shown to be correlated with psychological outcomes, retention in nurses, turnover, and safe patient care. This is so important for nurse leaders today as we focus on organization costs and as we focus on keeping our patients safe. The purpose of this project was to determine if mindfulness-based interventions could increase resilience and the professional quality of life in registered nurses working in a medical intensive care unit. The goal is to show if these interventions increase those measured scores through a pre- and post-survey for measurement. Helping staff increase their professional quality of life and thereby decreasing suffering has been linked to decreased turnover, which has also benefited patients through decreased errors, according to Mueller 2017. The correlation between nurse retention, engagement, and patient care outcomes highlights this practice problem as significant in both quality and safety surrounding care delivery, which prompts nurse leaders to invest in a nursing resilience because of this need. The project targeted a group of critical care nurses within the setting of a medical intensive care unit. The tools utilized for this project were the professional quality of life and the 6 domains of resilience scales. The interventions were performed daily at each shift huddle over the course of 8 weeks. Staff were asked to do 3 things during this time. Staff were asked to name 3 good things that happened recently. The staff were asked to also focus on counting the respirations for 30 seconds, and the staff were led to perform a tension-relieving stretch by their charge nurse or clinical supervisor doing the huddle. Data was collected utilizing a pre- and post-survey that included both of the aforementioned scales, as well as a few of the demographic questions added for years as a nurse, years on the unit, education level, and working status. Data analysis and data collection revealed that there were 17 respondents for the pre-intervention survey and that there were 5 respondents in the post-intervention survey. There were a total of 42 nurses who were available to take this study. The pre- and post-group averages for both the professional quality of life and for the 6 domains of resilience were compared. When comparing the results for the professional quality of life scale with the pre- versus post-group averages, there was a 1.3 increase in compassion satisfaction. Though this did keep the group overall score in average, it was very close to getting to high. There was a 3.8 point decrease in burnout, bringing the group average overall score down to the low range from average, and a 3.6 point decrease in post-traumatic stress, though this did keep the group overall score in the low range. When comparing the results for the 6 domains of resilience for the pre- versus post-group overall results, there was increases in all 6 domains of resilience, as well as an overall resilience score. Vision had a 2.5% increase, composure 4.2% increase, reasoning 8% increase, tenacity 1.6% increase, collaboration 14.9% increase, momentum 4% increase, health 11.3% increase, and the group overall resilience score rose by 6.7%. The result significance and implications show that the post-intervention survey results indicated a decrease in burnout and traumatic stress, as well as an increase in compassion satisfaction and overall resilience. This study does add to the body of knowledge regarding interventions to increase nursing resilience and professional quality of life through targeted mindfulness-based tactics. Limitation to the study were study sample size, pre- versus post-respondent numbers, length of the intervention, and generalization to other nursing specialties. Future recommendations would be to further repeat studies to duplicate results and then to implement across other nursing specialties. That way we can better determine result generalization.